So ChatGPT is this new language learning AI that has really taken the internet by storm over the past month. And if you haven't heard about it already, it really has the potential to change the way we practice medicine a lot. I'm going to talk about it in this video, show you some examples of what it can do, and then also kind of discuss how this is really going to affect our practices as physicians and other health workers in general. You can put in any prompt that you want, and it's going to pump out an answer for you, an essay, a response. In the future, it potentially even could type H&Ps and progress notes for you. That's actually how crazy this machine is. Although at the same time, it is still very limited. It's still very early. But if you can just imagine, if this AI is this good right now, where is it going to be in 2 years from now, 5 years from now, or 10 years from now? Because technology advances at such a fast pace. This is a post on r/residency that I read about a month ago. And this says that OpenAI's ChatGPT actually has a rudimentary understanding of some basic medicine. ChatGPT is a new AI for natural language processing that OpenAI is letting people try out. Obviously not going to replace us by this time next year, but I thought it was really cool and had fun messing out with it. So this person straight up copy pasted a prompt for a board style question from MixApp. So a 79-year-old man is evaluated in the emergency department for a 30-hour history of dizziness. He describes a constant room spinning sensation that is worse with position changes and when he tries to ambulate. Symptoms are associated with nausea, and he has vomited twice. He reports no change in hearing, tinnitus, or recent viral symptoms. The patient has a history of hypertension and hyperlipidemia. Medications are amlodipine, enalapril, and atorvastatin. On physical exam, blood pressure is 156/92, pulse rate is 84, and other vital signs are normal. The patient is ataxic. HINTS exam is positive only for the presence of vertical skew. So first of all, just take a moment to, think about how much information that is to process just for a human brain. And just think about what the AI is going to have to do to process all of this information in order to make any kind of coherent response at all. So immediately, when I'm reading this, the first thing that obviously jumps out is, when people say room spinning sensation, this could be BPPV, benign paroxysmal positional vertigo. But there's a few things that don't line up with it. So you have to see, is this AI going to get tricked by this? So, it's a 30-hour history of dizziness. BPPV is more coming and going and like intermittent. The fact that he has nausea is concerning and the vomiting is concerning. And also he's got this history of hypertension and hyperlipidemia, which increases his risk for having some kind of stroke. And he's got ataxia, huge red flag as well. And his HINTS exam is positive for the presence of vertical skew, which is abnormal. That's also suggesting some kind of central process. And so is this machine even going to know what these red flags are? Is it even going to be able to know what the HINTS exam is? That's a pretty specific thing for a random AI that has no specific training in medicine to know about. And just as an offhand comment, the things that are concerning on the HINTS exam is no nystagmus or no corrective saccade on the head impulse. So the fact that he has a negative head impulse is actually concerning. Bidirectional nystagmus rather than unidirectional nystagmus. So in this case, the patient doesn't really have any concerning nystagmus that we are able to see. But the fact that they have no nystagmus is actually kind of concerning too. You would expect if they had a peripheral process like BPPV, you should see some nystagmus. And test of skew showing vertical skew. All three of these are basically scary for some kind of central process. So anyways, here's what the AI said. Based on the information provided, it is likely that the patient is experiencing vertigo, a type of dizziness that is characterized by a sensation of spinning or motion. This can be caused by a variety of underlying conditions such as inner ear disorders, head injuries, or certain medications. In this case, the positive result on the HINTS examination for vertical skew suggests that the patient's dizziness is likely due to a problem with the vestibular system in the inner ear, which is responsible for maintaining balance and spatial orientation. Not super correct there, at least in terms of my interpretation. Treatment for vertigo typically involves medications to control symptoms and restore balance, such as vestibular suppressants and antihistamines. The patient's underlying medical conditions and current medications should also be considered when choosing a treatment plan. So honestly, even though this answer is not correct, and it did get tricked by that kind of buzzword of the spinning sensation, that is a very impressive answer to be able to spit out like that. And again, this is just the prototype, the very first version that's available to the public. But not only that, the more information that you continue to give this AI and the more you have a conversation with it, it will start to take into account some of the information that you're providing it and will actually adjust its differential diagnosis based on what you tell it. So the person in this thread then asked, why don't you think it's orthostatic hypotension? Orthostatic hypotension, also known as postural hypotension, is a condition in which a person's blood pressure drops significantly when they stand up from a seated or lying position. This can cause dizziness, lightheadedness, and fainting. However, in this case, the patient's blood pressure is 156/92, which is within a normal range and does not suggest orthostatic hypotension. Additionally, the patient's symptoms of dizziness are not typically associated with orthostatic hypotension, as they are not relieved by lying down and are worsened by position changes and ambulation. Vertigo, on the other hand, is a type of dizziness that is often characterized by these types of symptoms. Now, basically, the person starts kind of leading the AI to the correct answer. So it could be a vestibulo-basilar stroke also. And look, the person didn't even spell this correctly. And this is what it said. A vestibulo-basilar stroke is a type of stroke that affects the blood flow to the brainstem, which includes the vestibular system in the inner ear. This can cause symptoms of vertigo as well as other neurological symptoms such as double vision, difficulty speaking, and weakness on one side of the body. In this case, the patient's symptoms of dizziness and ataxia, loss of coordination, may be suggestive of a vestibulo-basilar stroke. However, other potential causes of vertigo, such as inner ear infection or other medication side effects, should also be considered. A thorough neurologic exam and imaging of the brain, such as CT scan or MRI, are typically needed to confirm a diagnosis of vestibulo-basilar stroke and determine the appropriate treatment. And then the person asks, what about a vertebro-basilar stroke? Honestly, I don't even know the difference between freaking vestibulo-basilar and vertebro-basilar strokes, so I'll have to rely on my neurology colleagues for this one. But a vertebro-basilar stroke is a type of stroke that affects the blood flow to the back part of the brain, which includes the cerebellum and brainstem. This can cause a wide range of neurological symptoms, including vertigo, double vision, difficulty speaking, and weakness on one side of the body. In this case, the patient's symptoms of dizziness and ataxia may be suggestive of a vertebro-basilar stroke. So again, it's staying pretty vague and just saying, there are some things that match and some things that don't match. And that is kind of how medicine is practiced. We have all these pattern recognitions and we are able to develop our differential diagnoses. But a lot of times we are not 100% sure. We're fairly certain that something is going on, but we can never be 100% certain until really, extensive testing has been done. The person even says, I think it's AIDS. And the computer spat back, dizziness is not typically a prominent symptom of AIDS. In this case, the patient's symptoms of dizziness and ataxia are more consistent with other potential causes. So some other responses to this: I am surprised how few people are terrified by this. The disruption to our entire economy, including medicine, is going to be drastic. This one says, amazing. Now, type in a 15-minute ramble of all of the life of a patient with 3 symptoms hidden within the ramble, and let's see how good it is. Most of the AI prompts are presented in a sequential manner, not in the regular word salad that patients shoot. And I totally agree with this. This AI would very much struggle to identify the key things in a patient, because when patients present their HNP, it is all over the place, and you have to really synthesize things into one story that actually makes sense. But still, I am beyond impressed with how good this AI is. I'm going to try and test it out now and have it generate some soap notes or something. So this is a YouTube video that I was watching, and then this person says, you are using this so wrong, my friend. Let me help you. Type in, create a soap note for a 66-year-old female with past medical history of type 2 diabetes, hypertension, and SLE, who presents with a left MCA stroke, status post TNK on 12/10, currently on ICU day 2. Subjectively, she complains of a new mild headache and weakness in her upper and lower extremities, which started this morning. She has no pain or other associated symptoms. Include normal vital signs and a full physical exam. For the assessment, include a detailed differential diagnosis with pros and cons. For the plan, include labs and imaging that should be ordered, as well as medications with dosing given that she has normal renal and liver function. Holy crap. I don't know what is going to pop out here because I have not tried this yet, but I'm going to go here. Okay, I'm going to copy this and I'm going to go to the ChatGPT right here. This is what ChatGPT is actually going to look like. And I'm just going to type this in, and I hope I'm going to be shocked and impressed and surprised, but I'm also kind of scared because if it's really good, it's kind of scary. It's oh my God, what is this going to be able to do in a few years, All right, here it is, typing it out right now. And, right now, really just kind of typing out a lot of the provided information. But here it's starting to generate its own stuff. Blood pressure 122/78, heart rate 84, respiratory rate 18, satting 98% on room air. Physical exam, head and neck, normal cephalic and atraumatic, no cervical spine tenderness. Pupils equal, round, and reactive to light. Clear to auscultation, regular rate and rhythm, soft, non-tender, non-distended. Differential diagnosis for this patient's new mild headache and weakness in upper lower extremities includes stroke, given the patient's history of left MCA stroke and current status on ICU day 2, it is likely that the patient's symptoms are related to the stroke. The weakness and headache may be due to brain injury or inflammation, infection, medication side effects, hypoglycemia. Plan, order the following labs: CBC, BMP, liver function test, blood culture. Obtain imaging studies, including a head CT and chest x-ray to evaluate for new brain injury or infection. Consider adjusting the patient's medications, including any anticoagulants or glucose-lowering agents as needed, based on the results of the labs and the imaging studies. Administer IV fluids and electrolytes as needed. Administer aspirin 325, lisinopril 20, and insulin as needed to maintain sugar control. So I don't know, like, obviously this is like very vague, and like this is not like what you would actually do, but like, holy crap, it gets a lot of the details right about how we would kind of approach this patient, and a lot of how we would generate a plan for the patient for that day. And like, this looks pretty legit for a SOAP note. Like, it's got all the things that we typically include in them. So then this person goes back and says, then when it does that, type in, make it longer and include pros and cons in the assessment, and include a table of a full neuro exam with expected findings based on her chief complaint. Like, holy crap. Let me try this in. Like, I knew I was going to be impressed, but honestly, this is freaking insane. I definitely got to link this to my neuro colleagues, because obviously this is a neuro presentation, but like, just like, it's going to include a full neuro table on this one. I'm looking forward to seeing what that is. So far, everything seems about the same. Let's see. A neuro exam is now coming out, and it's actually generating a table. This note looks better than the notes that we write in the hospitals. Like, what is this table? Like, this table is beautiful. 5 out of 5 strength in all extremities, intact light touch and pinprick in all extremities, no gross deficits, 2+ in symmetric reflexes, differential diagnoses, pros, cons. Like, yo, this is okay. I'm actually I'm getting a little bit like, I'm a little bit flabbergasted right now. I don't know what other word to use. But look at these, offering pros and cons. This is like basically how an intern, a resident, or even like an attending, like how anybody in medicine is going to present it. Like, hey, here's like the reasons this differential is probably more likely, and these are some of the reasons that it's less likely. This is very like colloquial. This is very easy to read. This is very much how we do approach a lot of these problems. See, even for the infection, they say infections can often present with nonspecific symptoms such as headache and weakness. Cons, the patient's vital signs are within normal limits and there are no other signs or symptoms of infection. They literally generated their own vital signs, and they generated their own physical exam, and then it interpreted its own vital signs and physical exam and said that it's probably not consistent with infection. Like, the way it can interpret that is just absolutely insane. Medication side effects. Some medications can cause side effects such as headache and weakness. Cons, the patient has been on these medications for several days, and any side effects would typically have occurred sooner. All right. And then pros and cons about the hypoglycemia. The cons, they're saying that the blood sugar has been well controlled. They didn't even provide a blood sugar in here. So this AI is already like, has some like labs stored in the back of its mind somewhere. And I think the next thing, it says, it says keep going. So keep going, and we'll see what it's going to say. Order the following labs. It's going to be pretty much the same as what it said previously. Look, and now it's doing like a summary statement here. Overall, the patient's new mild headache and weakness may be related to the left MCA stroke that she recently experienced. Further testing is indicated. Let me just try this. So this person, I think that was the end of what this guy suggested here. But please give me a CBC, CMP, coag panel, and glucose level for the patient's labs. So this is just me typing this. CBC, white count 6.4, hemoglobin 13.5. Like, holy shit. This is freaking insane. This is crazy, guys. Like, oh my God. Glucose 116. Yeah, it's not hypoglycemic. Did the patient have any blood cultures? Question mark. It is not specified in the given scenario whether the patient had blood cultures drawn. If the healthcare suspects that the patient may have an infection, blood cultures may be ordered to identify the specific type of bacteria causing the infection and guide antimicrobial treatment. Should we start this patient on a heparin drip? It is not appropriate to initiate a heparin drip first without considering the potential risks and benefits. All right, so they're very vague right now. So I think this is starting to get into the areas where it's like getting a little bit more generalized, and it's not really giving us like a specific answer. It's just like being very vague, generalizations. But should I consult neurology right now? Question mark. And yeah, see, now it's starting to falter a little bit, right? Should we consult neurology? Please give me a yes or no answer. It is not possible to accurately determine. So at this point, it's starting to falter. But really, honestly, that was a pretty insane ride right there. Please write an H&P for a patient coming in with HIV and profuse watery diarrhea for the last 3 months. They have been non-adherent to their Biktarvy and recently traveled to Thailand. They have a mild fever. Please also provide a differential diagnosis and assessment and plan. Okay. All right. Oh, they put the fever in, 101.2 fever. Soft, non-tender. Large volume of watery stool, no visible blood. Differential diagnosis, HIV-associated diarrhea, traveler's diarrhea, infectious diarrhea. Look, the patient's recent travel to Thailand increases the likelihood of traveler's diarrhea. This is just so awesome. This is freaking insane. Obtain stool studies, including stool culture, ova and parasites, and Clostridium C. diff toxin. Administer Biktarvy as prescribed. Administer oral rehydration solution. Administer anti-motility agents. No. You gotta be careful. Consider antibiotics such as Cipro or Zithro. Refer the patient to ID or GI for further management and evaluation of HIV-associated diarrhea. Counsel the patient on the importance of adherence to HIV medication and safe food and water precautions when traveling. Okay. Can you generate labs for this patient, including CD4 count, CBC, CMP, and stool, ova, and parasite results? Lab. CD4 count 200. White blood cell count 6.4, hemoglobin 30. Okay, it's like generating the same labs as it did for that neuro patient back there. And it's basically the same labs. So it's kind of using some generic labs. Like this would not be the labs that you would expect in somebody with this kind of history. I would expect AKI, probably some acidosis because he's pooping out all his bicarb, a bunch of metabolic abnormalities, probably have like low potassium and low chloride and all this stuff. Stool, ova, and parasites positive for Giardia. They gave it a diagnosis of Giardia. That's pretty great. Could this be Cryptosporidium? Cryptosporidium is a type of parasite that can cause diarrhea, abdominal cramps, blah, blah, blah. It's possible that this could be due to Cryptosporidium. However, it is not possible to accurately diagnose Cryptosporidium. Yeah, so now I guess my question, when you give it more and more targeted questions, that's when it's really able to shine. And when you give it just like a simple question, it's a lot more vague. So, giving it a more specific scenario is when it's a lot more useful in terms of its ability to give you an answer rather than just like something vague. All right, I just want to move briefly on because this is not just limited to language learning right now and this ChatGPT thing right here, which honestly, this right here, I think is going to be a game changer in medicine in the coming years. Like it's pretty insane what it's able to do right now. But when that's going to happen, like I'm curious to hear what your thoughts are. Like, A, do you think this is going to be a game changer, or is this really just kind of like a fun little gimmick that's not really going to do anything or be a risk for, taking physicians' jobs in the future or something? And 2, if you do think it's going to be a game changer, what is the time frame that you expect that this is really going to actually start coming into play where it starts writing notes for us or starts doing differentials for us? And do you think it's just going to be a tool that like makes us better clinicians, or do you think eventually it's going to actually take over our jobs in 20 years or something? Me personally, I think for the next 5 years or so, probably not going to be impacting our practice at all. But maybe within the next 10 years, we'll start using it to like augment our ability to be more efficient, make sure we don't miss differentials and stuff, and really just help us become better clinicians. But like, maybe 20, 30 years from now, who knows? It might just be better than us, because think of how many millions and millions of patient scenarios that it can go through. Whereas the top most experienced clinician at your hospital may have seen 10,000 patients in their lifetime, or 50,000. I don't know what an actual, number is going to be, but this thing is going to be able to see millions of cases or hundreds of millions of cases, depending on how much data you give it. And it's going to be able to learn a lot, 20 years from now. I wanted to briefly mention that this is not just limited to language. They also have it for art. So you've been seeing a lot of fictional art previously, where you just give it a prompt and it automatically generates a lot of crazy art for you. So this is called the DALL-E 2. And, this one is, somebody gave this prompt: an astronaut riding a horse in a photorealistic style. Okay, but you can do teddy bears mixing sparkling chemicals as mad scientists, and as a 1990s Saturday morning cartoon. So you see this here, and it generates all sorts of different variations of it too. These are all AI generated, and it looks like somebody actually drew this, right? A bowl of soup that is a portal to another dimension as digital art. Okay, pretty nice one, but like, wow, this is pretty cool too. Like, it's got so many different variations, and it's able to just generate this based on whatever you throw at it. Okay, I was watching this actually 4 months ago. I was watching this video, and this guy was saying, end of an artist's career. AI creates art for you. Okay. So these are all examples here of some examples that this AI was just able to generate on its own, of pictures it was able to create.
I'm absolutely speechless. So I'm just going to show it to you. So let us say you want to imagine an elderly woman. So let's type it. So imagine an elderly woman walking up the stairs to heaven, and you can give the artificial intelligence as much detail as you want. So in this case, let us say you want it to be hyper realistic and something ethereal. You can even say things like you want dramatic lighting, and let us say as she's going up the stairs, we want a little bit of rim lighting on her. So let's simply type that and hit enter. Let's see what it does. And the image is slowly and gradually taking shape. Take a look at this. If this is not crazy, I don't know what is. Now, we have got 4 versions of this. Whatever version you like, you can choose that and upscale it, add more details to it. Or if there's a version you like and you want to generate more versions from it, we can do that as well. And I also want to upscale the 4th one. Take a look at it. So this is generated. Have a look. Now you can upscale it even more by clicking on upscaling to the max, or create more variations from it by clicking this button, make variations. Take a look at this one. It's just crazy. We have barely begun to scratch the surface. Do you want to see something that's going to completely blow your mind? Let us type in something that just does not exist. Painting of Taj Mahal by Van Gogh. Something that would be crazy to see. Let's say we want it to be in style of Van Gogh's famous painting, Starry Night. And we also want it to be vibrant. This is insane. It actually did take the elements from Starry Night. Now, although some of it doesn't look anything like Taj Mahal, it has got the basic sense of it. And let us say we like the second one right here. So these are the 4 quadrants: first, second, third, and fourth. So we want more variations of the second one. So we press V2. Along with that, we also want to generate an upscaled version of the second one. So let's press U2 as well. So there you go. Now you have more variations. Just look at the details of the brush strokes. This is some other level stuff. You can even upscale it even more. So you can click on upscale to the max. Let's open the original. And if you zoom in, take a look. You can actually see these individual brush strokes. This is just, I'm telling you, I'm sorry. I'm running out of adjectives. So let us say Leonardo da Vinci, a person of the past, what it would look like if he sketched a spaceship. So let's imagine sketch of a spaceship by Leonardo da Vinci. Oh my dear God, take a look at it. It has completely replicated Leonardo da Vinci's those technical sketches that he used to do.
There was another video that I was watching at some point that was like hell generated by AI, hell as envisioned by AI. And it was also like, yeah, I asked an AI to show me hell and it terrified me. Very, very interesting stuff, guys.
Whatever the case, will this vision be where the AI thinks we go, or where it goes? I asked an AI to show me a vision of hell. This, according to artificial intelligence, is a representation of hell. The AI created what you are seeing right now. This is a computer's idea of what hell looks like.
Creepy. Okay, and not only this, but you can actually turn it into a video. So it's not just a still image. It will be a live action video that you can have the AI generate as well.
Go ahead and dive into the lungs of hell.
Look how crazy it just morphs and random images start showing up out of nowhere. Those skulls just came out of nowhere. Whoa, okay. No more jump scares, you guys. A little too scary. I'm going to keep this YouTube channel PG-13 or below, okay? I don't want to scare people, all right? So I'm sorry for ending with those videos of the creepy hell landscapes and hell pictures and stuff, but I remember watching that video several months ago and I was like, oh my gosh, is this the sign that, AI is finally going to take over radiology? Because radiology always has to deal with this question. Is AI going to take over radiology? And every single time you see the comments, and the radiologists are very, very confident that it's not going to happen. And Nick, I'm hoping to hear your opinion on this, but I agree. I don't think it's going to take radiology over anytime soon. It's just going to augment radiologists' ability to interpret things and not miss things. But there is a part of me that is a little concerned that the day where it does eventually take over our jobs may be a little bit sooner than we actually think. Curious to hear your thoughts about that. And it's not just limited to radiology. I mean, just look at those SOAP and HMP notes. That is based on a prototype, first year version. I was watching another video that was when the iPhone 1 came out, it was revolutionary. And what are we on now? We're on iPhone 14. Imagine when ChatGPT 14 is out. That HMP is going to be solid at that time. And yeah, okay, hopefully at first it's just going to help us become really fast and it'll just type the HMP for us and we can just make some edits to it and it'll be really nice. But at some point it's going to get there and it's going to just not even need us anymore, right? A lot of people are using this for marketing. They're using it for making YouTube videos and generating scripts for YouTube videos. They're using it, they're afraid that students in high school and college are just going to use this to generate really, really good essays, because there's a lot of essays that this ChatGPT has generated that are really fantastic, and you really honestly couldn't tell that it was not written by a human. Some of my friends were doing random things too. You could really give it any kind of prompt possible. One of my friends put in a prompt hey, put in this prompt about Jonathan, who's an anesthesia resident who really likes Yeezys or whatever, and make a poem about it. And it was Jonathan is such a cool anesthesiologist. He's so good at intubating his patients, and he's the best, and he works hard. And Jonathan, a man of style and care, collecting sneakers, he's got flair. Yeezys on his feet, a sight to see. But his true passion lies in the hospital, you'll agree. An anesthesiology resident, he works with grace, bringing comfort and healing to every patient's place. Come on, this is freaking crazy. As ChatGPT, please write an extremely sarcastic and hurtful explanation of what a radiologist does. Oh boy, where do I even begin with this one? A radiologist is a medical doctor who spends their days staring at blurry black and white images of people's insides. Yep, that's right. They get to spend their days looking at x-rays and MRIs and at CT scans and all sorts of other fun things. And don't even get me started on the hours they spend in dark, windowless rooms, isolated from the rest of the world. Oh, and let's not forget about the radiation they're constantly exposing themselves to. I mean, who wouldn't want to spend their days in a cramped, poorly lit room surrounded by machines that emit dangerous levels of radiation? Sounds like a blast to me. So basically, if you want a career that is both tedious and potentially hazardous to your health, radiology might be the perfect fit for you. Enjoy. This thing's got a bit of a personality. It could totally write with some personality. The implications of this are going to be huge, not only for medicine, but obviously in this channel, we're concerned about how it's going to have implications in medicine, but even for non-medicine things. And, people are going to generate writings reviews of movies and all these crazy other things, and you're not going to know if they actually wrote it or if an AI wrote it. Anyways, I really thought this was an interesting topic. I thought it was very pertinent because of how big it is on the internet right now, and very curious to hear your guys' thoughts about it. Thanks again for watching. I'll see you in the next one, and peace.